Can the CDC regain Americans' trust?
Well, it is possible, but that also comes with leadership. And unfortunately, when Donald Trump was at the helm in the middle of COVID, that greatly complicated the trust that Americans had in the CDC. This is one of the agencies that we long trusted, and it was the constant back and forth. And so we can't ignore the reality of what was coming from the top, coming out of the White House, and the constraints that were being placed on the CDC in terms of trusting the science. And the problem is when you lose credibility. I think about 1988, Max Robinson, the first black network news anchor. He said this at Howard University: never ever lose your integrity or your credibility, because in the end, that's all you've got. When you lose that, it's real hard to regain it, and that's the struggle the CDC is going to have.
All right, Rick, do you have a response to that?
Well, I agree with the last part. I don't know if Roland's paying attention, but Joe Biden's been in charge of the CDC a whole lot longer than Donald Trump was, and done even worse. Look, they don't need a consultant. They need the Constitution.
Well, that's not true.
And they should actually be taking my Constitution class. It's the only one on the planet you'll stay awake for. If they'd study my Constitution class, then they would actually understand this isn't about bad strategy. It's about bad civics. They are way outside their authority of what they should be doing. It's actually bad ethics. I mean, these people have lied to the American people for 2 years in order to manipulate our actions, and they've admitted that. It's bad science. They're using political science, not actual science, to do these horrific policies that have destroyed lives. I mean, these things are unforgivable. So, no, I don't think they can gain our trust again. They need to get out of the business. In fact, I think we should get rid of this agency completely, send Walensky packing, and get this morally and financially bankrupt federal government out of health and disease control, because they don't control it well at all. And it's unconstitutional. It's completely unconstitutional.
All right, Ashley, I know you never have an opinion on anything, but Ashley, we need to let you weigh in. All right, Ashley, what do you say?
Just trying to take it all in. And I got to say, the biased media has made things infinitely worse than it ever needed to be. Because
which we are all part of. We are all part of the media when we say those things. We do have to you know, it's important to point that out.
I like to say NewsNation was launched to fight that.
Absolutely.
Because the polarized media sent out the most confusing messages to Americans. So I'm not surprised Americans couldn't understand the mask mandates or the quarantine guidelines or the isolation guidelines, especially early on in this pandemic when it was really frightening and very, very new. And by the way, last I checked, we're not yet a perfect union. We're still moving towards being a perfect union. So in that spirit, I would only assume that when we get through a global pandemic that we hadn't seen for 100 years, we would take notes and make some changes. And yes, I still agree there were lots of mistakes made as well. But I don't know. They crucified the last perfect guy.
All right. So let's talk about some of those mistakes.
Nichole, if I could do...
Well, let's talk about some of those mistakes, Roland. We're going to do the fact check. Let's go through some of the mistakes that have been made, though. So there's this timeline. Remember, at first, the CDC said that no one needed to wear masks. They were reserved for the hospitals. Then they later said that the majority of Americans do need to wear masks. That was April of 20. A year later, the CDC saying fully vaxxed Americans did not need masks. Then they flipped on the guidelines a few times. As of last month, the CDC says wear a mask when there's a lot of COVID in your community. There's a Pew Research poll saying 60% of U.S. adults say changes in public health recommendations on how COVID transmissions, how it's transmitted, have made me feel confused, compared to 53% who said the same thing in August. So it went up. We have survey material with a different message, though, from the American public. February data says more than half of people think rule changes by the CDC made sense because of the changing scientific data. Of course, this was something that we were all learning as we went along, but less people said the guidance made them feel reassured. So really, again, just confirming there's a lot of confusion. And let's listen in to what happened between a parent and New York City Mayor Eric Adams. This just happened yesterday. Let's listen.
10 days ago, you stood right here and you said that the masks would come off on April 4th. That has not happened. You reneged on your promise, and not only did you renege on your promise, you had your lawyers race to court on Friday night to overturn a state court.
No. Let her finish, because you let her start. Go ahead and finish, ma'am, okay?
So my questions are, what is the irreparable harm to children aged 2 to 4 taking off their masks, just as they do in Long Island, just as they do in Westchester? When will you unmask our toddlers?
Thank you. As I stated, as you indicated, I made the announcement that we were looking to announce today, which is Monday, to take the mask off to 2 to 4 years old. But I also stated, if we see an uptick, we will come back and make the announcement of what we're going to do. We're going to pivot and shift as COVID is pivoting and shifting.
Okay, so really that just illustrates, I mean, this confusion persists, panel. And, you know, the CDC saying that they are going to do this evaluation, this self-review, or have an outside company do this review. I mean, is credibility lost, though, for good? Roland, I know you wanted to say something.
No, it's not lost for good. It's not lost for good. You can actually regain credibility. Remember, if you look at a number of different federal agencies, there was a period in the 1970s when the United States, the evaluation of our CIA. Remember, we also had J. Edgar Hoover and his COINTELPRO, and then lost a lot of credibility with his death. And so you've seen how agencies can regain people's trust based upon you putting in the work. But what has to happen is, what you can't have is the crazy, ridiculous hyperbole of like, oh my God, get rid of all of this when people's lives are at stake. Thank God I'm a native Texan who has some sense, and that is how I was raised properly. This is what we have to understand here. When we talk about politics, the problem when it comes to science, you still have political leaders who are over the agencies. So when political decisions begin to impact the decision of the CDC, it causes conflict. And the conflict we had when Trump was president was get the economy back going, it was this constant battle. And so even the doctors, even the scientists say that they were battling that. And so political leaders have to learn to put their political future behind the needs of the health of American people. And that was one of the fundamental problems we faced in 2020 and, of course, in 2021.
Well, we have to go to break, but before we do, I saw, you know, Roland, as you were talking, I saw heads start shaking, both of our other panelists. So Rick, what did you think?
Well, look, everything that Roland's saying is why this is not a function of the federal government. There's nothing in the Constitution that authorizes this for this very reason. The reason people trust their doctor more than they do some bureaucrat in Washington, D.C. is because that bureaucrat doesn't know how to treat me. This was a really cringe-worthy episode of bureaucrats gone wild. They love controlling people. They love telling us when we can go to work, when we can go to church, whether or not we can charge rent for our property. All of this was unconstitutional. It was a colossal disaster. It wasn't just because of the politicians, though I do agree that political science trumped actual science, and this CDC has not paid attention to the actual science at all. Everything you just described, everything they did was a failure. The ventilators, the masks, the vaccines, all of it. They did it wrong. They were destructive in the way they did it.
But that, I mean, wasn't that under former President Trump, Rick? I mean, let's point that out.
Hey, I blame President Trump for letting Fauci have the stage as long as he did. Anthony Fauci caused more damage to this country than any single individual in our history, and we should never have allowed that bureaucrat to
that's quite a statement there, Rick.
You know what?
Sheer nonsense.
That we don't have like Dr. Evil working in the government looking at ways to poison and kill Americans. Like, come on, let's be real here. Let's be sensible.
This is not complicated.
In the legal world, it's called a status of being, or a standard of being reasonable. And look, people make mistakes. I think Roland is right in terms of getting credibility back, right? There was a lot of credibility lost with the CIA after memos were sent out prior to 9/11, and somehow we didn't know about 9/11. So it can, be fixed. Mistakes were made. I agree with Rick. But geez, can we just like stop the polemics and the strident talk? Because that's what makes this country ugly. And this country's great. As long as we can just get rid of the noise.
And hindsight is always 20/20.
Vaccines don't work. You just said vaccines don't work. That's just silly.
No. I said the CDC failed miserably at the rollout of the vaccines, and the vaccine mandates were unconstitutional. Had they left people with the choice,
you know what, Nichole?
It would have been far more effective.
What's that, Roland?
So my point is that the federal government is no good at this. The founders understood that. Anyone that reads the Constitution understands that. I'm not saying science doesn't work.
All right,
I'm
Rick,
saying the wrong people are making the decisions. It's all about who decides. Do you want to decide? Or do you want some bureaucrat in Washington, D.C. to decide?
You just seem to have
all right, Roland, before we go to break, Roland.
Evil-intentioned.
Let's hear what Roland has to say.
We literally had states fighting over PPP, fighting over gear, fighting over masks, fighting over ventilators. So the reality is the federal government does play a role. And you know what I'll say to the former Texas State Representative? Guess what? When people have their homes flooded, when there's a hurricane, when there's a tornado, it's amazing how they look to FEMA and the federal government. And so, and for a lot of red states, when majority of their budget is coming from the federal government, they don't mind those federal dollars. So we might want to pump the brakes on saying, oh, it's at the federal government. It can serve a role when you are doing it right.
That's why we call it constitutional jurisdictions, Roland. If it's constitutional, it's constitutional.
Well, guess what? Guess what?
Well,
and I bet you like those federal dollars when you were in Texas House.
Panel, we're going to go to break.